Now, turning to our program, please welcome Alec Knutson, Government Affairs Director for the Milwaukee County, to introduce our speaker.
Good afternoon. My name is Alec Knutson, Government Affairs Director for Milwaukee County Executive David Crowley. I'm pleased to introduce James Mathy, the Administrator for Milwaukee County's Housing Division. James has over 25 years of experience in housing and mental health. He holds a master's degree in public service from Marquette University and administers Milwaukee County's various housing programs, including Milwaukee County Housing Authority, Home Program, CDBG funds, homelessness programs and outreach, and real estate development. James is the author of Milwaukee County's plan to end chronic homelessness, which helped Milwaukee County realize extraordinary success by adopting the Housing First philosophy, which focuses on increasing access to permanent housing, combined with wraparound services that includes mental health and substance abuse and job training. Since 2021, due to the hard work of James and the Housing Division, Milwaukee County has had the smallest, or one of the smallest, unsheltered homeless populations per capita in the entire country. During the pandemic, Milwaukee County led the nation relative to our ability to get critical rental assistance out to our community quickly. As a result of this remarkable work, Milwaukee County has been tapped by the Biden administration and the National Association of Counties to train other counties on best practices, and recently was featured in the documentary Beyond the Bridge, A Solution to Homelessness. The Milwaukee County Housing Division is one of the most dedicated group of public servants that I've ever met. They're relentless in their mission of public service and helping our community, which I think that means they're a very good speaker for this group here today. I'm pleased to turn over to James Mathy. Jim.
Good afternoon, everybody. Thank you, Alec. I think we should just go right to the Q&A session because I think Alec pretty much hit all my slides already, so thanks for that, Alec. So again, thank you for having me here today. My name is James Mathy. I'm the Administrator of Housing Services for Milwaukee County. So we have a bit of a unique structure in housing services. I know Rob Hinken is a Rotary member, and he was responsible for part of this many years ago when he was the DHHS director for Milwaukee County. So Alec mentioned some of our programs, but it is a very unique structure. So in housing services, we administer all of the Milwaukee County's community development block grant funds, which is for economic development, housing, and public service in our suburban communities, excluding the city of Milwaukee. Home funds for affordable housing. Milwaukee Continuum of Care programs. These are rental assistance programs for homeless individuals coming through the local Continuum of Care, which the city of Milwaukee is the lead agency for that. What a lot of people don't know is Milwaukee County runs our own housing authority. So I'm the Administrator of Housing Services, but also function as the Executive Director of the Milwaukee County Housing Authority, so that is separate from HACM at the city. So we have close to 2,000 voucher holders that live throughout Milwaukee County, some in the city and some of our suburban communities. Eviction and homeless prevention, real estate development, especially lately, and I'll cover this momentarily about our increase in investments in affordable housing. We partner a lot with private real estate developers to do real estate developments throughout Milwaukee County. And then outreach services, Housing First, which is a lot of my content here today. So a lot of folks in the community don't know that we do our own homeless outreach in Milwaukee County. We're one of the only local government agencies in the nation that do our own homeless outreach. And I'll kind of explain why we chose to do that way. And again, everything that I'm talking about today is under the lens of social determinants of health and within our Department of Health and Human Services. We are the only housing division in the country, especially that run a housing authority, that are under a Department of Health and Human Services, and this was done very intentionally. So when we started our homeless program, the goal was to take all of these various federal programs and local funding, put them under one roof, really with the mission of serving the most underserved in our community is the reason that it was structured this way. And then we started our Housing First programming around 2014. So when I say Housing First, very briefly for those of you that did not hear the term, so we call our homeless programs Housing First. It is a general philosophy, and what Housing First is going to say is kind of the old way of doing housing, where we would take individuals who might be living on the street, we would see if they want addiction services, We would see if they want to clear up their warrants, get sober, and all these different things to then have access to housing, and that does not work. So what Housing First says is we're going to take individuals that you might see outside, skip all these various steps of shelter, transitional housing, and take individuals and move them directly into their own apartment. And they determine where they live and they determine their services. So Housing First is not housing only. So we're providing permanent housing with voluntary services attached to that housing. So again, most of our clients can choose the neighborhood they live with a rent assistance voucher of ours or different housing supports, and can choose their case management. And that's going to mean something different to everybody. It might mean very intense mental health and addiction services. It might simply mean, they're not ready for that, but they lost contact with their family, or they haven't had a job, or they need help with IDs and those different types of things. If that's the service you want to make you successful in housing and permanently end your cycle of homelessness, that's what we're going to do for that individual. So really, we kicked this off in 2014. Our community was not necessarily following the Housing First model. Milwaukee County did not have any homeless outreach within our local government. It was generally handled by local nonprofits. It was County Executive Chris Abley at the time that pretty much said if we were to kind of blow up the homeless services system and make a big impact using best practices, what would that look like? So we came up with the idea of bringing Housing First throughout Milwaukee County, starting our own homeless outreach team, and choosing some additional strategic partners. So at the time, there was a lot of homeless individuals in downtown Milwaukee. Business leaders, one of our biggest partners is Beth Weirick, who I'm sure a lot of you know very, very well. So it was initial meetings between the police department, the district attorney's office. Kent Laverne was an early partner in all this, and Beth Weirick, to basically say what we're doing in downtown Milwaukee is not working. We see the same individuals outside. They get arrested on municipal warrants. They get put in jail. They're back 48 hours later downtown. What we're doing isn't working. We need a new approach. So a lot of those individuals were the first adopters of this Housing First strategy. And we really focused our initial outreach efforts in downtown Milwaukee. And we're able to show a significant decrease in homelessness in downtown. So we educated our business leaders. The mayor and the county executive were there. We brought in the founder of Housing First, Sam Barris, into town to kind of help us educate from a national perspective about what we needed to do. Unveiled our plan to end chronic homelessness. It was really the first major investment of local county dollars. Local governments often do not invest in homelessness. So this was really the first local government dollars, tax levy dollars that went to homelessness. We have a lot of problems using federal funding with all the different strings that are attached to that. Without local funding and philanthropic dollars to go to Housing First, there's a lot of things we can't do with traditional federal funding. So this was really our kickoff with that. And really to try to, the point of this presentation was really to talk to businesses about a new way of looking at housing and homelessness. What can we do to talk you into being a part of this large partnership that we're trying to build, and really re-educating business owners and community citizens about permanent housing and what it looks like to partner on not just traditionally what you all would hear about homeless shelters and those types of emergency services, but what it would look like to invest in permanent housing programs, not just as government or as HUD, but as private citizens as well. So when we started, again, I mentioned we did our own homeless outreach. We were a little surprised to learn what we found. So we started with 3 outreach workers, hired somebody to run our Housing First program. Aaron Collins Dyke is his name. Some of you probably know his work. We certainly couldn't have done this without him. So what we were finding is individuals that nobody had seen before. And this is an example. His nickname is Grizzly, which is what he likes to be called. He was the first person that we housed in Housing First. He was homeless for 25 years, living on the streets, not in a shelter, but on the streets. That's what we were encountering in 2015 with individuals that had a length of homelessness this long. And it was fairly consistent. So again, he was the first person that we took into our program. And again, what a lot of folks don't understand, and homelessness is certainly in the news quite a bit with the park and rides and everything else, the majority of individuals we see directly on the streets are going to refuse traditional homeless shelters. So there's a lot of conversation about, do we have enough shelter capacity? The question should be, do we have enough housing capacity? Majority of individuals outside will not accept traditional emergency shelter. And Grizzly's the perfect example of that, but he would accept housing on his own terms with voluntary services. So this is just kind of an example, fast forwarding to all the different partners we have with Housing First. So this certainly takes a village. Even though city and Milwaukee County government are heavily involved, these are all the different partners. And we kind of talk about this around the country. The unique thing, I think, local government has to take a leadership role in the issue of homelessness. And you see a lot of institutional partners on here. For communities where nonprofits might take a lead in homeless services, it's hard to get the buy-in from large institutional partners. So what I mentioned before when we started, we're talking district attorney's office, we're talking Milwaukee Police Department, the Sheriff's Department, business district, HMOs and hospital systems. We get direct funding from local HMOs and hospitals as a government entity, which is certainly unheard of across the country, proving the efficacy that if we work with HMOs and we take their hardest to serve individuals, we will save an awful lot of money and permanently end someone's cycle of homelessness. But we found it was a lot easier to get these institutional partners because we were coming at it from the county executive's office and a local level of government versus a traditional nonprofit structure. So one of the things that's most important to us is our resident advisory council. So I listed all the partners we have. The most important partners that we have are individuals with lived experience. So when you're informing ways to improve homeless services systems, you have to listen to individuals who are actually homeless. So we have a resident advisory council that is full of formerly homeless individuals that are in our Housing First program and advise us on a policy perspective. And it's certainly not a token advisory council. Anything we send out for requests for proposals for contract, they score them. They do the policy changes. They help us write our contracts. They help us determine where our funding should go, and it has made a tremendous difference. They catch things all the time that we did not envision when we started all this. So they've been invaluable members of this. We just received a fairly substantial MacArthur grant to do reentry housing. It'll be the same thing there, working with justice-involved individuals to really help us inform what our model should look like and how we can be successful. So I mentioned street outreach. We are, without question, the most active street outreach team in the county. So there are some nonprofits doing this work, which you certainly appreciate. Our team is out there consistently, as you can see on this slide. So I know a lot of you heard about the park and rides and these various situations. We are there virtually every single day. So first shift and second shift, again, most local governments across the country do not do their own street outreach. We thought it was best to do it that way because we could quickly connect individuals directly to our housing resources. So instead of various handoffs, we're able to do our own street outreach with our outreach team and arm them with access to permanent housing as quickly as we possibly can. So obviously our community does not have enough housing to meet the needs of every single individual. But the good news is there are no Grizzlies homeless for 25 years. The individuals that are in encampments have only been homeless for a very brief amount of time, which does make it hard to use federal funding with all the different qualifications. We are supposed to house individuals with lengthy histories of homelessness. The good news is we at least don't see that in our community anymore. And the other important thing about outreach, to do effective street outreach, you have to be there very early in the morning or very late at night. Street outreach, which is convenient hours for most people, don't work for the people we serve. So we're going to be going to those encampments at midnight, at 3 o'clock in the morning, 5 o'clock in the morning, ensuring that people are where they are. That is necessary to do effective street outreach. So just some data. Everything we do is following data and best practices. So when we started this in 2015, we firmly believe that the number one North Star metric has to be reductions in homelessness. If we're going to ask business owners and HMOs, philanthropic groups, city government to contribute to Housing First, the North Star has to be for that investment. We have to demonstrate annual reductions in homelessness. Doing presentations across the country, I'm always surprised that that does not seem to be the North Star. But for those of you, investing in charities that really care about homelessness issues, I would ask you, when you're thinking through the issue of homelessness, is what you're doing as an agency going to reduce homelessness? That should be the North Star of this community. And that's how we drove our Housing First program, and it's 100% data driven. And as Alec knows, we are a very, very competitive group of people in the housing division, which I think has served us well. So we look not just at our local data, but national data to see how we compare to other cities. So we compare ourselves to large cities, like cities, with the goal of having one of the best homeless programs. So as you can see by the slide, 2 consecutive years, we had the lowest unsheltered count in the country per capita. We compare that to warm weather cities, cold weather cities, all across the country. So that is the standard that we want to keep to really try to be the best that we can be for our Milwaukee community, showing reductions in homelessness. So you will see from 2022 to 2023 an increase. So we had almost a 92% reduction in unsheltered homelessness since we brought this model to Milwaukee County. That fell to about 54%, which, as a lot of you know, across the country, homelessness is increasing in every single community. But that 96 number was still smaller than basically one other community in the country. So another graph, one of the most important things when you're dealing with homelessness is serving the hardest to serve. And those are individuals that are chronically homeless. So an individual that's in a shelter or sleeping on the street for a year or longer at a time. So we're able to show 2 consecutive years we had 0 chronically homeless individuals unsheltered. We're the only community that were able to say that. And then we talk a lot about racial equity in Milwaukee County, and it really informs a lot of our budgetary and programmatic decisions. African Americans represent a large number of homeless individuals in our community versus the general population, which is completely unacceptable. So we try to tailor a lot of what we do to address the issue of racial equity. And we're able to show a 70% reduction in unsheltered homelessness among African American residents. So mention this just because with all the media attention, it's a little hard for local governments to talk about good work in homelessness. It's not a story most people are interested in. So what we wanted to get across is the model that we all brought here works. And the only solution to homelessness is permanent housing and voluntary services. We have a ton of work to do, as you all have recognized with the park and rides, a couple other homeless encampments that pop up. We all need to do better. So even though these numbers are great, they're not perfect, and we have to do a lot better than what we're doing. So I did want to address that increase in 2023 and why that was. So again, we don't want to just see that increase and say, well, we got all these problems. It is what it is. We don't have enough money, and there's nothing we can do about it. We didn't want to take that approach. So one of the biggest reasons for that increase that we saw is the affordable housing crisis that every single community has. We were a little surprised alone with national data. We have the 3rd most competitive real estate market in the country for rentals in Milwaukee, which is pretty mind-blowing when you think about the Seattles and Portlands and LAs of the world. It was incredibly difficult for us to find 1-bedroom units that even qualified under federal rent assistance standards. And it really slowed our work down, and that is what partially led to the increase that we saw. So we wanted to be able to laser focus on what we saw was the cause of that and see if we could change that trajectory of that slight increase that we saw. So what that was for us, we received some additional federal funds through the American Rescue Plan Act, but even more importantly, County Executive Crowley made a major investment into housing with our local American Rescue Plan Act funds, and it made all the difference in the world. So with the Home American Rescue Plan Act funds, those are funds we got directly from the federal government. We hired 4 housing navigators. Before, our street outreach workers would have to be the ones finding individuals housing. So you'd have to do your homeless outreach, do all the paperwork, show units. It wasn't very efficient. So we hired these 4 housing navigators, and their only job is to link individuals from street outreach directly in apartments as fast as humanly possible. That's their only job. With that funding, we dramatically were able to increase that. So we have 4 new ones there. And then expanded tenant-based rental assistance. So that's nothing. Again, the only thing that ends homelessness is housing. So we want to have as much rental support as possible, whether it's local dollars, federal dollars, or philanthropic dollars have made a huge difference with that. We're also, with ARPA funds, able to do a large expansion of our master lease program. It's a very unique program that the local governments generally don't do. This is a program where we in the housing division are the leaseholder. So the lease is between county government and the landlord and not necessarily our tenants. So we're able to get about 100 extra units of housing. We furnish the units, we have the keys, we pay the rent, and could quickly take individuals. A lot of individuals at the Park and Ride entered into this program. It doesn't necessarily matter what individuals' background checks are. We don't have to worry about criminal backgrounds and those different types of things. We can move folks into those units and then transition them to our Milwaukee County Housing Authority vouchers after that. It led to a pretty significant quick reduction when we did that program. So this is a separate slide. So the last formal numbers we have are point in time numbers, are a count of every single homeless individual in our community. HUD stamps those saying these are accurate numbers and they go into HUD. So the last slides you saw was our 2023 numbers. The 2024 numbers are not published by HUD yet. But all those investments did get us back on a trajectory where we needed to be. So between the previous slide and this slide from 2023 to 2024, we saw a 36% reduction in unsheltered homelessness and roughly a 17% reduction in overall homelessness. So 872 individuals in shelter and unsheltered. So again, we track this on an annual basis, and you oftentimes have to change what the data is telling you. You have to change your model. You can't do everything necessarily status quo. So that was extraordinarily successful. The bad news is a lot of our progress was done with one-time only funding. And next year, to be honest, could get a little scary and challenging here. We've already seen things start to increase again, as a lot of you have seen in the news. We're seeing that as well. So maintaining these numbers is going to be extraordinarily difficult. The county budget process is difficult. These are all non-mandated services. A lot of Milwaukee County's money are going to mandated services. It doesn't, frankly, leave a lot left. We are the only local government that is directly using tax levy to fund homelessness. These are extraordinarily difficult dollars to find. So next year is certainly going to be a challenge. We're already seeing that right now in the streets. So a lot of what we're talking about with unsheltered homelessness is not really getting at upstream investments. We're constantly in crisis mode, serving individuals on the street when we know the only solution is housing, and we need to make upstream investments in more permanent housing. So again, I mentioned through County Executive David Crowley, significant money was put into the development of affordable housing, and we're able to do things that we have traditionally never been able to do before. $20 million invested in suburban affordable housing. This is a great story for us personally in our division. Walking into suburban communities 5 years ago, talking about the need for affordable housing was not going very well. We noticed a big change. Even about 2 years ago, communities were way more open to affordable housing because they noticed their children couldn't afford rent in their communities anymore. Their workers couldn't afford that. So we're able to really focus on suburban development. Again, a lot of our federal funds are not used in the city of Milwaukee because the city of Milwaukee has their own funds. Also, with the history of segregation, I mentioned racial equity, with Milwaukee County being one of the most segregated counties in the country, unfortunately. We really wanted to address that with neighborhood choice and do affordable housing developments in our suburban communities. So we've been really successful with that. We have 6 new affordable housing developments in 6 different suburbs. Some suburbs that have never had affordable housing before. We have Whitefish Bay, Franklin, Greenfield. We're geographically dispersing our investments to try to do projects in each and every one of our suburbs. So we're very excited about that. Again, citizens have been way more receptive to those types of investments than they would have had before. $7.5 million investment in the King Park neighborhood, so we are not ignoring City of Milwaukee projects. So a lot of you may have seen or heard about our King Park project. It is right next door to the new Psychiatric Emergency Center and next to the county's new Marcia Coggs Human Services facility. We see housing as one of the main social determinants of health, so we also wanted to make an investment in the community with housing. So we did a competitive grant, won that grant for $7.5 million in neighborhood investment fund money from the state of Wisconsin, and are building 100 brand new homes in the King Park neighborhood for home ownership. Home ownership is an important part of our work. Historically, it has been homelessness. We're trying to do some wealth building with some home ownership now. So again, it's 100 brand new homes. They're going up right now. Habitat for Humanity and the MM Group are our two real estate development partners in that. So we're very excited about that. The other thing that we're working on, we are working on Milwaukee County's first affordable housing subdivision for home ownership in the county's history. So that is underway now. We have so far a $7 million investment, $5 million from Senator Baldwin through a federal earmark, and $2 million of local Milwaukee County money. We're going to build at least 24 single-family homes, possibly up to 40, in a very, very beautiful piece of land in Oak Creek. It's land that was a tax foreclosure by Milwaukee County that we've had on our books for many years. And this subdivision will look like a brand new subdivision, and we'll be working with a few local developers. We will be the primary developer for the first time in our division's history, but we'll be working with builders to try to mitigate that cost and hopefully get these homes up by 2026. And also we're rehabilitating county tax foreclosures. So any tax foreclosure in the suburbs that comes to the county, we're rehabbing those homes. We have a partnership with the House of Correction to do inmate job training. Those individuals get jobs upon their release, and then we sell these homes to first-time home buyers. So we're finally able to start making some upstream investments. A lot of individuals, we have trouble when I give these speeches. There's ultimately, what can we do? It's a little hard to give money directly to local governments, and a lot of people don't necessarily want to, but we would welcome that. We do have a charitable account. But we have a very strong partnership with United Way through their Safe and Stable Homes initiative. So a lot of you are giving to United Way. Their Safe and Stable Homes initiative, focusing on ending family homelessness. They will be looking to expand that to do some of the things that I've talked about today, maybe make some additional investments. So we always talk about investing more into safe and stable homes through United Way. So with that, I will stop there. I always close with the housing ends homelessness hashtag. Again, the only way to end homelessness permanently is investments in permanent housing and voluntary services. So I will stop there and hopefully have enough times for all your questions. So thank you very much.
Thank you, James. That was really terrific. And we have a new person holding the mic this week, and I'm going to tell you, if you don't keep your question concise, I'm going to put a spell on you today. So, okay, Mark.
You got the hook if we do. Section 8 provides vouchers to lower income people, and the selection for the recipients is based on a lottery. So my question is, what happens to all those people who don't win the lottery?
You must be a plant for that question. That's a great question. A majority of our progress for our numbers has been through our Milwaukee County Housing Authority with instant access to vouchers. Well, how do you do that? Through a lottery system. So HUD allows local governments and housing authorities to set their own local preferences. We chose our preference to be homeless individuals. So we have a separate process and a separate waiting list for homeless individuals. Any community can do that. So that's what we decided to do, and have housed more people through our housing authority than any other program that we've had. It really armed our outreach workers with more direct access to housing. And along with that, we waived all of our background checks, which a lot of housing authorities don't do. So there's only a few remaining qualifiers that HUD kind of makes us do. We got rid of every other requirement we could to match our waiting list. So again, communities that are running their housing authority with these lottery systems, the most housing communities have are through housing authorities. And that made all the difference in the world. We have probably housed well over 500 homeless individuals in our own housing authority because of those administrative changes that frankly any housing authority could do. Thank you for that question.
Thank you for your presentation, and congratulations to have NACO and folks looking at you is really a great privilege and honor. You talked about some obstacles, one-time funding, some lack of flexibility, et cetera. And you have a world-class program here. So what thoughts do you have? We're going to have a new president next year. So what thoughts do you have of having your program in the city and what's going on, whether it be corrections or wraparound services, whatever it might be a national model, a showroom, classroom, and meeting point that the federal government can invest in, and you can get things done that you want to get done?
Yeah, thank you for that. That's a great question. So we have been able to, Alec mentioned the film Beyond the Bridge, A Solution to Homelessness. That has garnered a lot of attention to maybe do some policy changes. What the federal government needs to fund more that doesn't is more flexible funding and prevention dollars. So again, when you look at the park and ride issue, a lot of those individuals have been homeless for less than 2 months in their entire life. And it's very hard to prioritize those individuals for the housing resources we're talking about. If our community had more prevention resources, that would make a big difference. So the two things advocating for moving forward are certainly prevention resources, where instead of somebody getting a tent, could they get one-time funding to stay in their housing situation, and then we bring the services to that house instead of sleeping outside, as an example. One of the things that's been very unique, and Milwaukee County is the only local government I've heard to do it, has used local tax levy for flexible dollars. So besides rent assistance, it gives us flexible dollars. HUD will not pay for a lot of the things we discussed, but our homeless outreach workers, at least for now, had access to county funds where they could do back utility payments, furniture to make sure they had their place furnished, pay any back rent they might have, all those bus tickets, all those different types of things that nobody else is going to pay for. That flexible pot of money is something we never had before. We had it in the county budget. Again, you all know the county's budget situation. Philanthropic dollars going towards flexible resources like that would make a tremendous difference. Thank you.
Thank you for your work. A number of years ago, I worked with NAMI, the National Alliance of Mentally Ill. Some of that population, even when they had a house, would go right back out and live in the woods. I would think some of your population you deal with fits in that category. How do you deal with them? And then what about security for your people that go out late at night to rescue?
Good question. So thank you for your work with NAMI. We have a very good relationship, of course, with NAMI. So we don't see a ton of individuals necessarily that go into housing and abandon their units and go back outside. But one of the things a lot of our clients struggle with is isolation. So even though you may have your first apartment, and it could be a beautiful brand new apartment, a lot of times you might be away from your social connections, and that's a huge problem for the people that we serve. So individuals oftentimes, may still go to previous encampments. They have friends there, and that's somewhat of their social support system, which is unfortunate, but certainly true. Another thing a lot of our clients use is we do not mandate that they have income. And one of the things our housing authority does is waive even minimum rents. A lot of the individuals who we serve are zero income. We house them, we help them pay for utilities, whatever that happens to be, but they're still going to use the meal sites. They're still going to use the traditional services like St. Ben's, even though they're in housing. What was the second question? Security. No security. So we go out in second shift outreach in teams. So we have a pair of licensed, trained, master's degree social workers. I think a lot of individuals on the street, recognize our vans. Everything is branded with homeless outreach, and we are bringing housing resources. We've been doing this for 10 years. Our team has not yet ran into a situation. Of course, we have a great relationship with the Milwaukee Police Department. In the 10 years we've been doing this, we have not had one of those situations.
Any conversations around the commercial scale 3D printing process for housing, like similar to Austin, Texas, what they're doing with Icon?
Good question. So we've been looking
Give a little
at
background on that. I'm not sure all of us know about 3D printing and housing.
Yeah, so basically 3D printing to actually start producing affordable housing. So we're looking at a lot of alternative housing models. That's happening a lot on the coastal cities where rents and the cost of construction, especially in California, are astronomical right now. So we have been looking at that. One of the things, again, with us using our own housing authority vouchers, we try to house as many people scattered site as possible with existing housing. So a lot of communities, they're doing housing first, and they're going to build a 50-unit apartment building for $13.6 million. And 3 years later, they're going to have 50 units, which is great. We all need to do that. But what about the crisis we all have here today? So a lot of that is taking a look at existing resources, retooling things, seeing what you can do. A lot of our clients like to get that voucher and choose whatever neighborhood that they live in. Another thing to give county executive credit for is we now have a landlord engagement coordinator where we network with existing landlords, find new ones, build those different relationships to try to find existing units. We do have to compete on the open market with regular tenants, but that's just what we have to do right now. If we have to pay double security deposit, additional damage funding, whatever that happens to do, that's what we've been doing. But we're certainly looking at alternative housing models, container homes, tiny homes, 3D printing. We're kind of keeping an eye on all that. Sometimes that's harder to fund than you think it would be based on tax credits and HUD regulations. Thank you.
Sorry. My question is, single-family homes are a relatively expensive way of providing housing. Have you given thought to things like co-housing or rooming houses or other forms?
Good question. So we certainly utilize rooming houses. Our community, I would say back in the 80s, had an awful lot of rooming houses called SROs, single room occupancy. Those are mostly all gone. There's very few rooming houses left. And that's the case with a lot of different communities across the country with zoning codes. Wasn't necessarily attractive from a zoning code perspective, but it was a model that our clients could afford on their own. Very few rooming houses exist in Milwaukee now. We are able to use our rent assistance vouchers in rooming houses if they're done the right way, but the supply of those in Milwaukee, they've either been transitioned to hotels or different models, but your traditional rooming houses are few and far between what they used to be. But it's something our clients could definitely afford without government assistance.
Thank you for your presentation. Maybe I missed it, but on your list of community partners, I did not see the VA or any veteran service organizations represented, and yet veterans comprise a significant percentage of people who are homeless, mostly those who've suffered physical, emotional, mental, or moral injury as a result of their service. What do you do to address the unique conditions that many of our homeless veterans face?
Great question. Thank you for that. So Milwaukee County doesn't directly fund veteran homelessness initiatives because our veterans organizations get direct funding through the Milwaukee Continuum of Care. So Milwaukee County does not run our own voucher programs for veterans. That's done through the Milwaukee Continuum of Care. So those are it's about $15 million worth of funds that come to our community. The city of Milwaukee is the lead agency with all of our nonprofit providers. And we as a group decide locally what is going to get funded. Veterans housing always goes to the top of that list. So Milwaukee County doesn't fund it directly, but all of our veterans homeless programming in the county is done through the Milwaukee Continuum of Care. And it's a pretty sizable investment. Thank you for that.
Thanks for the information. It's timely. I was just at a Pathfinders event on youth homelessness last week. So question is, they do a lot to help minors. Do you get involved with that, or do you refer those out when you're dealing with minors?
Great question. So the question was about our involvement with youth homelessness versus an organization like Pathfinders. So Milwaukee County is a direct funder through local tax levy for their shelter and case management services. So even though we're talking a lot about county government, all of our nonprofit partners, including Pathfinders, are a big part of this. Steve Bauer, who just stood up from the guest house, also one of our main partners that we fund directly. So yeah, we work hand in hand with Pathfinders. Talk to Tim Bach probably on a weekly basis. We don't see, to be honest, we don't see a lot of youth out on the street that are unsheltered. A lot of our youth, what we like to say, are kind of the invisible homeless in really awful housing situations, couch surfing, domestic violence type of issues. So they might not be individuals we all see, but they're there. They're just not traditional unsheltered individuals sleeping in tents that you would see. They're individuals in really bad domestic situations, kind of going couch to couch to couch, and that is a hard population to fund because HUD would say technically they're not homeless, they're couch surfing, which is another thing that HUD typically doesn't fund. So yes, we work with Pathfinders quite a bit.
Tim was just here a few weeks ago talking about human trafficking as well. It was a great session, especially within the LGBTQ plus community. Jim, I appreciate your partnership in general, but also your leadership nationally as well. If you could have or challenge one assumption that you feel people have about homelessness and housing in Milwaukee and here, and have these folks kind of understand one thing that you think people don't understand or don't fully have enough information about, what would you suggest that they need to know?
Yeah, I'll give you two. Thanks, Steve. And thanks again for all your work. Again, guest house, people think of guest house as a homeless shelter. They're way more than that. They partner with us and by themselves on permanent housing, and it really transformed themselves to a homeless agency and not just a homeless shelter. So thank you for your leadership on that, Steve. I would say the two biggest things are, number one, a lot of individuals just assume that because of the challenges unsheltered homeless individuals have, they have large behavioral problems and they're dangerous, and it's something that people need to be scared of. Again, I mentioned us being out on the street at midnight with 2 young female outreach workers, have not had an issue in 10 years. So there's this misconception that a lot of our homeless clients are dangerous, and if they're in your neighborhood, it's going to be problematic for your family and your children. It's really not the case. Our clients are more likely to be victims of crime and get taken advantage of than anything else. The other misconception, and the park and rides are the perfect example. Again, these are not individuals who have had any history of homelessness. A lot of them have income. A lot of them are working. So we've encountered people that are sleeping in their cars, that are working 40-hour shifts. They might have a bad employment history or an eviction history or different situations we're working through, but they're working. And even beyond minimum wage, with the slide I showed about the increases in rent, people making basic income cannot afford rent in Milwaukee, even as they could 3 or 4 years ago. So that would be the second misconception. A lot of our clients have income and they're working and they still can't afford their basic rent.
Good afternoon. Thank you for the work that you do. I, as a professional coach, work with clients who look to do things like this. And one of my clients is looking to own 2 homes by next year, specifically to house the homeless. What's a great first step for her to make to get that going and to organize?
It's a good question. So I will go back to the beginning if folks want to take down my email. You can have your contact directly email me. I'm happy to talk through that. So a lot of it is working through zoning codes and different types of funding, what the city counts as transitional housing versus a rooming house. All that can get a little daunting, especially for grassroots individuals that kind of want to get into this business. So a lot of it is just working through zoning codes, ensuring, especially for us, again, if our North Star is reductions in homelessness, if an individual is in a shelter or transitional housing, they're still homeless. So working with a provider to say, how do we take that new housing unit and make it permanent housing instead of your traditional concrete type of shelter or transitional? But I'm happy to have you outreach to me directly. Sure.
Jim, you mentioned that there's a MacArthur grant about to come into fruition to help with people coming out of incarceration. Do you want to tell us a little bit about that?
Sure, thank you. So we were one of 6 communities across the country to get a direct award from the MacArthur Foundation. It's called the Just Home program. So at the start, it is a planning grant where we're taking 9 months to really plan out how this community can have a real impact on homelessness with individuals returning from incarceration. Specifically, the Milwaukee County Jail is the focus of the grant. So we're doing a 9-month planning process with various stakeholders, most importantly, people with lived experience, being right at the table with our team. Part of the grant is we're funding stipends for all of their time to to really look at what we haven't done here correctly in Milwaukee. And after that 9 months, we're eligible for up to $5 million of additional funding through the foundation to actually build new housing. So for us, it's going to be more of a crisis housing. So instead of somebody going to jail or right when they get into jail, if they have severe mental health issues that led them to that arrest, simply because they had nowhere to go or mental health challenges, they could directly enter into our housing program to divert them from the jail. And then we'd also like to do really the first kind of re-entry affordable housing model that our community's seen with the rest of those funds. So that will be a traditional apartment building, giving individuals access to those units and the services they need. Our community really has not done that before. So after the planning process with people lived experience telling us what those services should look like, then we have access to those first-time housing investments to build new housing.
We're just about out of time. We all remember stories. Is there like one story of the families who were living in the park and ride that really sticks out with you that you'd want to share about how they got there and then what they're doing now?
Yeah, unfortunately, a lot of the park and ride situations sound the same, and they're sad ones, but they're not necessarily the stories we used to hear. I would say our best stories are the individuals involved in our resident advisory council that I mentioned earlier. Individuals that give a lot of their time to advise us on policy. 2 of those individuals were homeless for over 15 years with all kinds of challenges. Now one of them sits on the Milwaukee Continuum of Care Board. They score all of our RFPs. They're individuals that if you sat down with them, it's very emotional. One of them especially just with a awful history of trauma, which is another thing, Steve, you brought up that a lot of people don't know. A lot of our clients have such an awful history of trauma that's a little hard to overcome. So to see these 2 individuals in particular be able to move directly off the street right into housing with all of their challenges, accept the voluntary services after they were in housing, to see a lot of what you saw here today would not have looked this way without those 2 individuals by catching things we did not catch over the past 10 years. Our resident advisory council is a lot questioned, probably our biggest success, and maybe you'll hear from some of those folks in the future. One of them is featured in the documentary film that Alec mentioned that's now on our Continuum of Care board. So that would probably be our best example.
Well, thank you, Jim. I know that we all feel we learned a lot today, so thanks for all you do.
Thank you, Ray.